for everyone to join. Welcome everyone to this webinar for mental health for parents. Give us 1 minute to let everyone join and we'll get our presentation going. All right. Dr. Daruwalla, are you able to see the presentation?
I am. Thank you for checking.
All right. Well, today we are very excited to host this webinar. Med Global is an international NGO that provides innovative and sustainable healthcare services for vulnerable communities around the world. And so we are very aware of the need for proactive measures to take for mental health, especially during challenging times where there is a lot of change and unsettledness like a pandemic such as COVID-19. And so we are happy to bring this webinar with our friend Dr. Daruwalla today. And we want to welcome all of you parents who are joining us. Thank you for taking some time from your day and investing in your mental health and some ways to hopefully help you care for your families and their mental health as well. So yeah, I am Becca Sheehy. I am the volunteer coordinator for Med Global, and I will be introducing our presenter for today. Dr. Shaznin Daruwalla is joining us from Oregon. She is a licensed psychologist practicing at Oregon State University. She has received her doctorate from Wright State University and has experience as a volunteer with Rohingya refugees in Bangladesh, as well as providing pro bono work for refugees in her community in Oregon. And so we are very excited to have you with us today, Dr. Daruwalla. I have really appreciated your candor and your kindness while we've been working to put together this presentation. And so I'm really excited for all of our guests to get to hear from you today. So I will hand it over to you and yeah, we'll get going. If any guests have questions, feel free to type that in the chat box and we will answer those either throughout the presentation or at the end for a dedicated Q&A time. All right, take it away.
Thank you, Becca. Well, again, and thank you for that introduction. And I also wanted to extend a warm welcome to all our guests. I'm so glad that you could make the time to attend this live, or if you're watching it in a recorded version, thank you again for taking the time. I hope you find some of the information helpful. Before we get started, I wanted to also comment on, as Becca mentioned, we are in the midst of not only a COVID-19 pandemic, we are also in the midst of a racism pandemic. And so I wanted to give acknowledgement to the systemic injustices as well as the persistent and long centuries of oppression that Black people, Native people have been experiencing in this country, as well as the anti-Asian racism that made public news in the beginning of or in the early months of this pandemic, and all of this continues to happen. I'm also realizing that one of the things when Med Global asked me to show up as a guest speaker for this topic, I took the frame of the public health and the global crisis and did not consider the frame of the racism pandemic. So I wanted to acknowledge and be open and hold myself accountable for if it feels like the information might not be speaking to your experience as a parent of color. My apologies for that, and please use the chat box as as well as the Q&A box to for us to have a conversation on this. Or, if there is something in the slideshow that appeals or kind of connects with you and you want us to go deeper, that is also something that I welcome in our chat. And I'm hoping that this is more than a presentation and interaction between you and I. So with that, we can get started. Two things that we're going to do, Becca, if the next slide, there we go, that we're going to do in today's presentation is talk about some information related to how do you take care of your children's mental health as a parent. So as you'll see later on in the slide, we have a couple of bullet points under that main topic. And then our second main topic is that as a parent, a lot of times the focus is on the family, or the focus is on the children and or our younger human beings. And so we oftentimes might, either feel guilt or might forget to take care of our own selves as parents. So we are going to, also talk about how do we take care of our mental health as parents. So let's get started. Going into the first topic, which is the pandemic and your child or children. What we are hoping to cover, or what I'm hoping to cover in the maybe, remaining 30 minutes or so, one of the main topics, as I said, is that we'll talk about how do you talk to your children about the pandemic? What are some things to keep in mind? We also understand that so main practice of mine is working with young adults. And I know that in talking and meeting with my clients, a lot of them have talked about anxiety. So across the age spectrum, different people respond to anxiety in different ways. So I'll give you some tips on how to calm an anxious child or how to calm an anxious human being. And we'll talk about the co-regulation piece, which is something that I'm excited to introduce to y'all, or maybe share more with y'all if y'all already know about it. And then finally, moving into if it feels like the family is not a sufficient container for the anxiety or for addressing pandemic-related concerns and fears, how do you as parents go about seeking professional help, mental health help? So those are the three topics that we will be covering in this particular section of the webinar. Next slide, please. So to getting us started with how do you talk to your child? And as you can see on the screen, there are a couple of main bullet points, and I wanted to elaborate on each of them. One of the first things that is important to consider when you are thinking of talking to your child about the pandemic, or I would say even sometimes these points can be helpful for any topic, is first thing is find out what does your child know. So that might include asking age appropriate questions. It might be also letting the child share with you what is the information that they have already consumed. That might be either through the media that they're watching. It might be through conversations that they might have heard at the breakfast table or at the lunch table. They might have maybe, caught you reading something or seen you reading something. So find out what is it that the child knows, so that you can then build upon that information, or even clarify that information or correct that information. That's the content piece. The other important piece is the process, which is how do you talk to your child? So it is important to be truthful with your child. That is including if your child asks you a question that you do not know the answer to, then say so. Maybe even use that as a learning opportunity and as a teaching moment, that you as the parent do not know everything. And I know that can sometimes create some anxiety for us. However, this can also easily transform into a learning moment for the both of you or all of you all involved. So it could be that, yeah, that's a good question. I don't know the answer to that. Let's find out together. And maybe, browse the internet or browse books or have a collective conversation about this. Speak calmly and offer reassurance, offer comfort. And also let the child or the children know that, let your child know that it is, okay to share their fears with you. And this is also really modeling for them that, yes, this might be a really anxiety provoking and an uncertain time that we are in. And it's okay to acknowledge that anxiety. It's okay to acknowledge those concerns. Something that I'll talk about a little bit later on in the webinar as well, around co-regulation as well as modeling, being, open and honest with your feelings, so that the child also learns to do that as well and internalize that. The other piece around, we've talked about the content, we've talked about how to communicate with your children. The next part would be how to help them feel in control. So that might include giving them practical tips and strategies. For the pandemic, it's really very clear, that wash your hands, wear a face mask, do physical distancing. So those tips we already, and look out for these particular signs and symptoms. So that is, very clear in terms of the practical strategies. And there's also, information about how do you wash your hands and for how long do you wash your hands. So all of that information are specific things that you can give your kids in order to feel in control, for them to feel in control. Similarly, it's important that you talk about the things that are happening to keep people healthy and safe. So the physical distancing would be one part of it, or maybe not going in a family of 4 or 5, to a grocery store is another piece of it. So again, talking about specific pieces of information. If the child shares with you, yes, I saw this on the news, it's also important, once you find out that that's what's maybe creating some of the anxiety or some of the questions, that it is helpful for you to put that news story in context. So that might be talking, maybe looking at the particular news item. It might be also perhaps, sometimes talking not just about that particular news item, but the larger context as well. So larger systemic context. I think about that in the context of racism. It's not just one news story, but it's, a news story in a longer history of oppression. So putting news stories, putting information in context is also, once again, giving you and your kids the container to hold that information. So it doesn't feel like there's more uncertainty flowing out of this particular news story, that you're able to give it a frame, give it a container. We also know that kids and teens often worry more about their family and friends than about themselves. So it's also very important to normalize for your kids that it's okay to feel stressed out. And particularly for this time in our lives, anxiety and worry and racing thoughts are all normal. As I will say in a future slide, all of those are really expected reactions to the current circumstance, depending on your positionality in the US. When it becomes overwhelming is what, can be a cue for actually seeking out support outside of the family. However, with all of the tips that I've shared in this particular slide, I want to end with an important one, which is keep the conversation going. So it is something that requires you to keep checking in with your child. It's not just, hey, we had this conversation one time, it looks like that helped you soothe, or feel some sense of comfort. Let's just, maybe I'm going to kind of seal off the topic. Everything is okay. We left it at a good note. Talk to your kids about current events often. So it also becomes a part of your interactions, because as families and as human beings, we do not live in a vacuum. We live in a context, and that context is ever changing. So keeping the conversation going also is another key part to the modeling that I've been talking about. Next slide. So one of the questions that I received was, asking about how do you calm your anxious child. Again, I want to say before, even as you're seeing these tips on the slide, different human beings express anxiety differently. So that's just one main, main caveat that I want to put out there. That some folks might, express their anxiety in more somatic ways. Some folks might experience anxiety in more cognitive ways. So a lot of thinking, a lot of thoughts. Some folks you might, might not even be able to tell you both. However, you might see it behaviorally, like, for example, yeah, you're shaking your leg, and I know that that's connected to something that's on your mind. So that's a nice segue into the first point, which is that it's important to find out what is on your kids' minds, and how you approach that, how you explore that is also in some ways unique to the relationship that you have with your child. I don't have a prescribed way of exploring that, because each parent-child relationship or caregiver child relationship is different. So what is the best way that you can find out what's going on? Some folks really would like to have a direct conversation, and some folks might, want to approach it more indirectly. For different ages, there are different ways of finding out what is going on for you, what's on your mind. The other thing, once you find out that what is going on for them, it's really important to not only express validation and listen, but also show that you care and understand. For maybe, the million things that might be going on for you, and things that might be on your mind, it might, give you some relative perspective on what your child is talking about, or what your children are mentioning as worries. And it's really important to stay present with the worries or the concerns that your child or your children are expressing to you. Going back to the previous slide as well, that it is really important to give kids solutions. So have them, maybe either you maybe give them a few tips based on what they are worried about, or you can explore together, as I mentioned. However, guiding them to those solutions will also allow them to feel that caring and that understanding, that it's not just a brief interaction where I felt heard. However, there is, someone who is taking an active interest in giving me solutions, or helping me find solutions, or connecting me with the solutions. The next point around keeping things in perspective, going back to what I said, as we maybe, age, or as our circumstances, personal circumstances shift and change, we might be getting, more and more perspective. It's important to also share that perspective, again, in an age appropriate way. However, it is also about the timing. So sometimes what your child may want from you is that reassurance and that comfort and soothing. Sometimes they might pull from you for more information and might ask more questions. So they might get that soothing or that hug from you. However, they're looking for something more than that. So again, as I said earlier, follow the child's lead. You'll probably, staying present, going slow, and co-regulating with your child will open up for you information on what is it that your children might be looking for in that particular moment. And that will probably depend on situation to situation. Being a good role model is about acknowledging your thoughts and your feelings, acknowledging your anxieties, acknowledging your concerns, taking time off for yourself, and also not getting overwhelmed or not dismissing your thoughts and feelings. So our children are looking to us, even when we do not feel like we are being watched. However, our interactions and how we work through our own stress and anxieties are giving, sometimes direct and sometimes indirect messages to our children about how to manage stress and how to manage conflict. Next slide. So part of being human is also having ups and downs. And some of those ups and downs and bumps in the road might be more maybe rough when we are in our formative years. Sometimes those might be when we are in adolescence and like hormonal changes are happening. And sometimes they might continue into young and established adulthood as well. One of the main keys on, hey, when do I, talk to a professional, whether that's a psychologist, a mental health professional, a social worker, or a psychiatrist, is just, I know that I'm giving you some, specific information. However, overall, if it gets overwhelming and if it impacts your functioning in a significant way, and or your kids functioning in a significant way, that would be one of the pink flags that I would have. So recognizing that every context and every situation is different. So in this pandemic, it is not uncommon for me to hear a lot of clients that I talk to about having a higher level of anxiety, or having difficulty sleeping, or having decreased appetite. Again, depending on the positionality of my client, for example, with international students, it's not uncommon for them to, maybe question their purpose of, seeking education in the US or staying in the US, and, having associated drops in their, sleep or appetite levels or concentration levels. So again, recognize what the environment is, and sometimes we, travel in different environments than our children, than our family members. So if you know the environment and if you know the context of your children, then it might help you gauge where these ups and downs are normative and where these ups and downs are concerning, such that you may want to consult with someone. And I would probably recommend the first person to consult outside of the family would be a pediatrician or a health professional who is more well versed with your child, and maybe have tracked your kid's development, or is more familiar with their medical and mental health history, so that again they have that frame of your child and are not using maybe a general textbook guideline as to whether this is of concern or not. So and your pediatrician can help you in getting connected with a mental health professional. Next slide. And I think as I mentioned that if things significantly impact your functioning, that's a sign for seeking consultation with a health professional. And I also want to really encourage you as the parent, as the caregiver, as the trusted, person, or the person who is familiar with younger, human beings in your life, that you know them best. So my, approach, if I were to meet someone, meet a younger adult for the first time, I might have perhaps the textbook version as a standard. However, if I were to talk to the informant, or if I were to talk to, someone who, spends more time with them, they might be able to point out for me that, yeah, this is really unusual. So I think that it's important as caregivers, as parents, that we also trust our instinct, trust our gut, and check it out. So test it out. So if it feels like, yeah, this feels a little bit off, or this is a little unusual, I would highly encourage you to test it out. What could happen is the pediatrician or the health professional might contextualize it for you, give their recommendations, and then that might be data or information for you to move forward along with your child as to whether you would like to continue in therapy or not. The other, after you probably have done that gut check with yourself, it's important to share your concern with your child. Check it out with them. Like, hey, I've been noticing that you've not been sleeping really well, or that you're not eating really well, or that you're struggling lately. Would you like to tell me what's going on for you? Or I noticed that this is really hard for you. I'm here if you want to share more about what's been on your mind. Does this feel like something we want to get some help with? they will be able to also share with you, if that relationship has been established, that yes, this is something that I would like to get it checked out. So follow your gut, check in with your child, and then consult with a health professional that's familiar, or a trained health professional, so that if you do end up seeking help, as I say in the slide, it is making life easier and hopefully happier for all the parties that are involved. Next slide. So taking a beat and maybe turning it over to you, parents. A lot of questions talked about how do I navigate my parent-child or children relationship, given that I'm spending a lot of time with my kids right now. How do I take care of my own mental health? And what are some practical ways of doing that? So I'm hoping that in this last section, we can turn the focus onto you. So take a deep breath if you've been, staying on your relationship with your child, to gently and easily and gradually come to yourselves, and let's focus on you. So one of the things that, next slide, please. One of the things that, as I was mentioning, is a couple of questions. One of the themes that I picked up on was this either feeling of guilt or feelings of frustration. Guilt may be related to, hey, because I'm spending so much time with my kids right now, I'm realizing that all the lost time that I did not spend. Or that, with schools being closed, I'm realizing that I have to do it all for my kids. How do I continue doing that without actually, creating an additional source of stress on myself? Or that my kids are now relying on me as not only, a parent, but also as a social and an emotional buddy. So first things, I just wanted to, share that it is real. I just want to normalize, and I want to acknowledge that parents are spending more time with their kids, or all of us are spending more time indoors. And if we're living with our families, then we are spending more time with our families. And that closeness and staying cooped up indoors can be an enriching experience, and it can also be a stressful experience. I thought this was interesting that a recent study, sometime done earlier this year at University of Michigan, talked about 61% of parents said that they had yelled, shouted, or screamed at their kids during the last 2 weeks at home. And this was an increase from parents' usual behavior. So that's, your group, that a lot of parents are talking about, having an increased level of stress, and that stress then manifesting in their relationship with their kids. So that brings me to the co-regulation piece, and I'm not sure if the audience is familiar with this concept, and I'm certainly no expert on it. However, I'll share my understanding of it, and if there's someone in the audience that has a better or different understanding, let's chat, make a comment or a question about it. My understanding is that, as I was saying earlier, that as families, we are not living, in isolation or in a vacuum. So also our nervous systems are not just living, yes, they are living in our bodies, but they are not just living by themselves and in a vacuum. That my nervous system, if I were in a room with someone else, would be talking to another nervous system, would be taking and receiving and exchanging information with that nervous system. And the same thing happens between a parent and a child. Ever notice that, when someone is probably, for example, screaming at you, or is expressing frustration at you, there might be some things that might be going on for you somatically that indicates that your nervous system is picking up on that data. This skin, it might feel like it is a barrier, and it's not, because it also picks up a lot of data from the environment around us. And so the co-regulation piece is really important, because all human beings affect each other's state of regulation. And parents and children do that more intensely than just about anyone else. And again, like I said, I'm no expert at it, and I wonder if there are biological and hormonal reasons for this, as well as psychological reasons, because of the parent child bonding or rupture, that our nervous systems have a different coding, and are likely to either trigger or soothe one another's nervous systems, as long as we are part of a family group. So in terms of, I guess where I'm going with this is, as parents, if we learn to shift our approach to conflict and higher stress levels within ourselves, like, for example, the shift might be approaching it more gently, approaching it more softly, more quietly, more in a more open way, normalizing it, acknowledging it, honoring it, then the child will respond with social engagement, will respond with curiosity rather than threat or moving back or withdrawing. And social engagement system is this is kind of somewhat based on polyvagal theory by Stephen Porges. Again, amateur understanding on my part. However, the social engagement system will get activated, and that will move the in relationship perhaps forward. It'll calm down the nervous system, as then both the child and the parents' nervous system start talking to each other and relating to each other, versus maybe withdrawing or distancing or using aggression. So I think that as adults, we have a more mature nervous system. And therefore using some of that maturity to the advantage in the relationship. So slowing down, giving yourself, so what that might look like as parents is that when you find yourself growing frustrated, or finding out that, oh, I'm feeling more irritable, or that I am increasing in my stress levels, how can I show an act of kindness both towards my kids as well as myself, and maybe say, I need a break, or I need to take time off, or I'm going to stay in this room, I'm going to do half an hour of this, or I'm going to go for a safe walk outside. Something that allows for your nervous system to get some space and to start to maybe come down regulate, as they say. So self-care is really important, because it allows you to build up that capacity, whatever is, however you want to build up that capacity, or even sometimes acknowledging and honoring your feelings and letting your kids know, hey, I really need to take a break right now. I'll return in, maybe let's talk about this tomorrow, or I'll return in, an hour. So you're modeling for them how you can pause conflict. That doesn't mean you're deflecting it, that doesn't mean you are suppressing it. You're you're putting up a boundary, you're communicating that boundary, you're also communicating when re-engagement might be possible, and you're asking for time for yourself. And that is, I think, healthy demonstration of what an interaction might look like when when our nervous systems are getting really stressed out. And I know that, as I also bring up this, perhaps template, that not all of us are afforded this advantage and this privilege. So I want to be mindful of that for some parents, it's really, not a possibility to ask for that break or for that pause. um, and my hope is that there's at least maybe a moment where you can check out of the interaction, ask, take a pause in whatever way that you are coping with. So I also wanted to acknowledge that this is a way of engaging in a compassionate and mindful relationship with your child. And we're all feeling the burden and the stress of being in survival mode for the past few months. and might not have that internal capacity or that internal resourcing to even ask for a boundary. So it's really, really hard. It can be really, really hard to ask for time and space. However, if that were a possibility, then giving your nervous system the opportunity, the space to downregulate can help with you then showing up for your children and for your relationship with your kids, and assist them and lead them in co-regulation. It can maybe even lead to your child giving you a hug. And that might sometimes calm us down, just as we know that sometimes, receiving a hug from a loved one really helps us start to downregulate. So I also wanted to say, as I said earlier, that as parents, we might need to initiate. However, our children can also help us, and who doesn't? And hugs can go a long way in that. Next slide. So this is probably, some of the things that I've already shared before, some practical tips on how to take care of your own mental health. As you're reading this, I also wanted to acknowledge another question that had talked about, how do I balance spending all this time with my kids, as well as not feeling that additional load or that additional surge of stress. And in doing a little bit of research around it, I also came across this interesting term, which at least I resonated with. It's called quality family time industrial complex, which talks about this special family time. And at least as I was thinking about it, it took me back to media and how media portray quote unquote happy families, and what does that mean? What does family bonding time mean? And who are the people who are represented, and what feelings are represented, and what activities are represented as, oh, this is you bonding with your time with your family. And that kind of, I think, really addresses the culture that makes it again a capitalistic endeavor, that going to a theme park might be the best way to show love to your kids. And I'm not trying to be judgmental. However, it's also important for us to stay critical of the culture that we live in, and what messages are coming from that culture about being good parents. And so this special family time ethos is really deeply embedded in the American cult of parenting. And interestingly, again, going back to some research that I came across, it sounded like there was a sociologist who did this study in 2015 that said that the amount of time children aged 3 to 11 spent with parents had no measurable impact on their emotional well-being, behavior, or academic success. The quantity of time mattered little. So I guess I was thinking that that's an interesting, what it brought up for me is that the quality of time. And then an earlier study was talked about quiet in between moments of family time. So when you're doing household chores, or when you're setting the table, or when you're looking at a catalog, or discussing, a news item, those are really, they did as much of the real work of family bonding. Like, they were really more richer moments of family bonding as any kind of like structured family time of like going to, planning out a elaborate vacation. So everyday activities are valued more than the fun occasions. So I think, again, maybe this is speaking more directly to the guilt. Is I would encourage you to maybe set some time on critically looking at where is the guilt coming from. Is the guilt coming from these messages that are, telling me that I need to be spending and really, doing these 5 hours of work, 5 hours of, spending time with my kids, and I need to be in charge of planning out their entire day? Yes, some of that might be true. Or is it coming from, feeling like I'm not even giving that quality time to my children? So again, find smaller moments. We are all living, in a productivity culture. So a lot of times we can all get into this thinking that more is better, and it's probably not, as some of the research that I talked about. Next slide. So we are coming to the end of our time, or at least my presentation, and I thought that I'll end with some fun times. There was again a question around, hey, what's the way that you can go to the next slide. What are some, fun ways to have, meaningful fun? And again, there's tons of things out there, and such as, famous museum tours. I really like this Children's Hospital of Orange County has this website that gives you all these different kinds of activities from online learning, such as Nat Geo quizzes and NASA teachable moments and Khan Academy Kids, to like YouTube videos and story time, to music class, to virtual field trips. Like I was like, wow, I want to be a kid again. So those are just, some of the, and then, I'm an art buff, so I like, the famous museum tours, and kind of getting a peek into some museums that I don't think I'll ever get to visit. So, or you can do a good old fashioned, stage a play. Think of a play that you want, get your family troupe together and stage it for an audience, maybe record it or, live stream it to family members who are not living with you. So, or cooking up something, exploring a new hobby together, doing some creative projects can also be a source of fun. So with that, I'm going to pause and check if there are any questions or comments or something that I said that maybe hit a nerve in the audience, or something that needs clarification. So thank you for listening.
Thanks, Dr. Daruwalla. I really am excited to check out this Children's Hospital of Orange County. That sounds like it's got tons of ideas, so thank you.
Yeah.
We do have a couple of questions. One is from what you were just talking about, it sounds like, if the quantity doesn't matter, what counts as rich quality time? So maybe, was there anything in that research that, yeah, you could expand on?
Yeah, I do not know specifically in the research if they talked about the quality time. I do remember them saying that if you are exploring together, and if you're present with one another, where you really do, feel this person. And I don't know if this, can be something that brings on a more somatic or a visceral feeling, that when you are in the presence of someone who is listening, is present with you, and maybe is, on that same wavelength with you, like if you're sharing a joke and they are laughing with you, or if you're, trying to find out something and they're right there with you. I think that's the quality that I might be thinking about, where it really, lets your kids know that they are loved, that they are looked after, that they have, someone who can share or commiserate with them or even guide them. So it's it's on a spectrum in terms of that quality time. Sometimes it could be really, struggling with you on that science homework, or it could be, really laughing with you about this, silly game or silly joke that you were sharing. So it's those that I think, probably those kind of moments that I would say considered more quality time.
Great, yeah, thanks for that. Okay, we got a couple of other questions. Someone's asking how to respect your child's wishes when they don't want to talk. So like if they're maybe a teen or a child that just doesn't want to talk, how would you handle that?
Yeah, I can gosh, a lot of thoughts coming up for me. So it is really hard. I want to normalize for the parent that it might be a really hard balance to keep, especially if you're noticing something that is of concern to you, and you've shared your concern with your adolescent, or with your child, and you're not getting signs or cues that this is an okay topic to talk about, in which case I would recommend that you communicate that to your child. So you let them know that you've shared your concern, that you have also very clearly received that this is not an okay topic to talk about at this point in time. And if things were to change, know that I am available, or know that this is something that I would be happy to talk with you at a different time. So it is more of it's less of the right here, right now. I say that because between a parent and a child, a caregiver and a caretaker, there's always a power differential. And as you know, if you're specifically talking about teens and adolescents and young adults, they're also, perhaps coming more and more emerging adulthood, as it's called. So they are coming more and more into their own individuation and independence. And part of this particular life stage is feeling invincible, is feeling invulnerable. So recognizing all these developmental influences and how they might perhaps make someone shut down to a person of authority rather than opening up. And similarly, for that person of authority to recognize and acknowledge that I understand that this is not an okay topic for us to talk about. However, if things were to change, and if you would like to share more, I am always available. The door is open. So I think it's hard sometimes as parents to when we come face to face with noticing something and not being in a position to provide and execute that solution that we think is appropriate. That helplessness is real. The struggle for containing that helplessness and that powerlessness is real. So I want to just normalize that. Give yourself some compassion and kindness in that moment where you're trying in some ways really hard to respect the individuation process that your child might be going through, and how you might feel like I still need to protect, or I really need to help this person out. So it is, again, when we are modeling for our younger human beings about how to navigate boundaries and how to respect boundaries, that show of respect as well as of my door is always open is, I think, a helpful lesson for them to then carry it forward to perhaps another relationship. So I don't know if that answered the question, but just thinking off the top of my head, I just want to say that's a hard one. Therefore, the compassion towards yourself is really important, and it's also perhaps, at least in the U.S. as an individualistic culture, it's something that's valued, which is this individual is trying to find their own identity. So it's important to respect that and to acknowledge it. And to honor it as well.
Yeah, and it seemed like throughout your some of your points, one of the underlying themes was that it may take time, and so that when there's not a quick fix, that building that relationship just may take some creativity and some time. So yeah, thanks. All right, we've got another question. So let's see. So what are some daily or regular practices to help with not getting overwhelmed with thoughts and feelings?
Is that for you as the adult, or as the child, or for your child?
Let's go with the adult.
Okay. So can you repeat the question for me, please?
Yeah, so it seems like they're talking about not getting overwhelmed with thoughts and feelings, and what
Uh-huh.
are daily or regular
Okay.
practices to help with this?
Okay. I would say maybe just as a frame, I would say a container is really important and structure is a really nice container. So have structure in your day. So that means that doing the same activities at or around the same time. Some activities that come to mind is doing some physical activity, spending time in nature. I know that we are being asked to spend time indoors. However, if you can put on that face mask, keep your physical distance of 6 feet, and go on that walk, maybe in the early hours of the morning, because I know in Oregon it's heating up over here, so early hours or later hours is really the best time to go out in nature. I think one of the consequences or outcomes of our tech lives is that we can literally spend our entire life, I know I can, in front of the screen, and I don't need, and other than getting my eating food needs met, I can literally spend 20 out of the 24 hours in front of the screen. So we have lost our connection. Some of us have lost our connection with nature. it there's research, again, I'm no expert and I can't quote you the research studies. However, there's research to show how the color green has a soothing impact on us, or how we have evolved in more natural settings than what we are living in today. So be out in nature, get some physical exercise or some physical movement, whatever that looks like for you, because that is a great key for stress management and anxiety management. If you're also able to find some quiet or some still time, and I guess I kind of want to say meditation, however, I use meditation as a very broad term. For some folks, it might mean, sitting in my backyard and just listening to the birds chirp, and every now and then a car driving by or a dog barking or footsteps. And I'm just, staying present. I'm still and I'm staying present. I'm acknowledging the sounds that come into my consciousness and that leave my consciousness. So that could be meditation, to all the way up to maybe a guided meditation practice where you really watch your thoughts, but you watch your thoughts as if leaves on a stream, and those leaves just kind of roll on by on a stream, that it's not staying stuck. And so the structure piece, the physical activities piece, going out in nature piece, again, there's a lot of messaging, and I say this intentionally, it is physical distancing, not social distancing. So it's physical distancing and social connecting. So that means that it does sometimes give us creative ways, and sometimes maybe some overwhelming ways to continue and nurture and nourish our relationships. So connecting with your loved ones, and again, that could be anyone you feel safe and comfortable and who is trustworthy in your life. Some folks really benefit from journaling, so writing down the thoughts. But again, keeping using some distraction activities. However, if you have a structure and if you have a container, that can also allow for not intrusive thoughts to come through. And then again, if the intrusive thoughts feel like this is really overwhelming, it might be helpful to consult with a mental health professional. No mental health professional is going to maybe say that yeah, I think it sounds like, give you incorrect information. I hope not. So if it feels like, yeah, normalizing it and then giving you some more tips, I'm not able to give you specific tips just based on the question. They might be able to understand a little bit more of your context and give you some more specific tips. However, generally speaking, it's also recognizing, it sounds like there is some distress, and then using maybe physical activity, using the human connections that you have, and perhaps for some folks, staying busy is another way to keep those intrusive thoughts at bay. And then if it feels overwhelming, consult with a mental health professional.
Great, thank you. All right, we will do one more question before we wrap up. Um, they say you talked about putting information into context. Could you give an example of putting COVID-19 into context for a 10-year-old?
Sure, sure. So, gosh, I wish I had, the website to this. And there was a video that I came across on YouTube that talked about, hey, there is a new virus that's going on right now. And, there is a lot of people, it has a lot of people worried and changing their behaviors, and not much is known about this new thing. However, there are a number of scientists working to find some solutions for it. In the meanwhile, some of the solutions that have helped us in keeping ourselves safe, as well as our neighbors and our friends and our family safe, is washing your hands for 20 seconds. And that's where you can, maybe pull up a YouTube video or demonstrate it with your child and say, hey, okay, let's do it together. Make it fun. I don't know how much y'all are tired of the happy birthday, but I've heard other suggestions for the hand washing song as well. So you can put on something, fun, and wearing a mask. And you can probably, put in some, again, 10-year-old age appropriate language that when some of the scientists have told us that when we breathe, some of those germs come out of our bodies and might, be contagious or infect, or, get someone else might get that illness if we are, that virus, if we have that virus. So using that mask is a protection both for you as well as for your loved ones. And then another piece around the physical distancing could be that, yeah, that germ really, once it gets out of our bodies, it can stay in the environment and it can be active for a very brief period of time. And so if it has a larger distance to travel, it's probably going to feel tired and it's probably going to die. So that's why we need to keep at least a 6-foot distance between you and another human being. And that can be, again, modified to your own family situation, because I imagine that, kids might ask about, hey, do I do this with my, other parent? Like, is it okay that you and I are sitting close right now? So it's also then recognizing that, yes, maybe one family kind of like shares its own germs. And that might be just how the cycle needs to go through. Just as when we have kids coming from daycare and, one parent gets it and then another family member gets it before it makes it cycle outside. So those are, I think that there are, child-friendly videos out there, and age-appropriate videos that really give it in very, I would say, child-friendly ways to explain that there is this virus, it is unknown, what it exactly does, and so we have to stay cautious about what we do so that we can protect ourselves and protect our community. So that big piece of, we are all of us are in this together. It's not only at the family level or the neighborhood level, it's at a much larger level. So I hope that was helpful a bit.
Yeah, I think so. Well, thank you so much, Shaznin, for being with us today, and allowing us to learn from you. And yeah, hopefully our viewers are able to take what you've talked about and implement that in their lives and with their families. And yeah, we're very thankful for you taking some time out of your day to be with us.
My pleasure.
Yeah, we will send some resources that you listed to the attendees. And we also have a resource that you created a couple months ago for mental health professionals on how to manage their mental health. And so that's available on our blog, medglobal.org, for anyone who is looking for more mental health tips. And please feel free to follow us on social media and Facebook to keep up with what is happening around the world and how COVID-19 is impacting other countries and other communities. So thank you, Dr. Daruwalla, and I hope you enjoy the rest of your day.
Thank you, everyone. Take good care. Bye. Be well out there.
Bye.